There are so many new technologies, video consultations, genomic medicine, blockchain, AI, so much hype around some of these areas. I get confused about what to focus on and what to apply my attention to. Wouldn't it be great if there was a system to think about and decide how you or your organization should focus on medical technologies? Well, there is. It's the hype cycle curve. And in this video, myself and Gandhi will explore the hype cycle curve for UK general practice for 2021. Hi there, Gandhi. How are you this morning?
Yeah, doing well, Andy. Yourself?
Good. Yeah, I'm pretty good this morning. So, Gandhi, it's a time for reflection. It's a year-ish since we all went into lockdown. What were you doing on the 21st of March 2020? Do you remember?
Andy, I can't barely even remember what I did last week, let alone last year. Any ideas?
Well, I'm going to jog your memory here. So this was us. So this is an episode we put out on the 21st of March 2020. There we go. Wow. Things have changed, haven't they? Is that 2 meters that we're standing apart? I'm not sure.
I think it's just about 2 meters. Yeah. Yeah. And you're right. That's probably the last time that we were actually recording at your place for the pod blast.
Yeah, I think so. So for those of us wondering if we broke the lockdown at that stage, we didn't. We'd recorded this actually, I think a few days or a few weeks before, so we weren't technically in lockdown at the time it was recorded, but it was definitely coming up to that date. So so we were looking at the primary care hype cycle curve and predicting which technologies were of interest and where they were on this thing called the hype cycle curve for the coming year, which was at that point 2020. During that episode, we made some predictions and we said we'll look at them again in a year's time with the hope of making this an annual thing. So here we are, roughly a year later, to revisit the hype cycle curve for general practice and renewing and refreshing it for the year 2021. You up for it?
Let's go for it, Andy.
Let's go for it. Good. So we've got a lot of new subscribers since this point in 2021. I don't know how many we had back then. We've certainly got in excess of 4K now. How many subscribers would we have had in March 2021, Gandhi?
So I got an update a couple of days ago. About 5 days ago, we had, this time last year, 1,053. So we nearly quadrupled, or over quadrupled what we had, which is an amazing feat. And thank you to all of our EGP learners for supporting us and stuff. And yeah, we kind of wanted to make this an annual thing, looking at, I guess, the change that happens in general practice in particular. And yeah, the hype cycle curve is an interesting place to go from, isn't it?
It is. So that's the last slide. It's the first slide. So we've got a lot of new subscribers since this time last year, and a lot of people won't have seen that original video and won't necessarily know what we're talking about when we're talking about a hype cycle. So I'm going to do a really, really quick crash course very quickly about what a hype cycle is and why we might be interested in it. So it's a hype cycle is a graphical representation of the maturity and adoption of trends in technologies. It's something that I don't know whether Gartner, who is a US consultancy company, I don't know whether they invented it, but they're certainly most famous and most connected on the internet with these hype cycles. So I feel that we should just credit them and go over to their website or Wikipedia article if you want to know more, because there's a lot more information about hype cycles and how they might be useful there. Why might it be useful? Well, they're a good way of conceptualizing how new technologies can go through a journey of adoption from discovery through to mainstream use. They recognize that the amount of hype around a technology doesn't necessarily correlate to how useful it is at that point in time. Some things never make it to the end of the hype cycle and never really get fully adopted. It's also interesting to look at the phases that they go through, because the level of hype and interest in a technology is not consistent and linear as it goes through its process of being developed and adopted. So let's look at this. So this is the hype cycle for US medical stakeholders in 2020. I don't know if they've done their 2021 hype cycle yet. We're not going to focus on the details, but really just these phases, just to talk through how something might move through the hype cycle and understanding the graph. So along the bottom, you've got time. So time progresses in a linear fashion forwards. And then you have expectations, or we could use the word hype in a way around this. And what you find is that technologies move from their innovation trigger. So it's when they are discovered and people don't know very much about them. There's just a sort of select few who are close to those discoveries and involved in getting excited about them initially. Then they move sort of up the curve as more people are aware of them and become excited about the possibilities of that technology until they reach the peak of inflated expectations. So they're not necessarily a long period of time along the journey to adoption, but this is often where we're hearing the most about a new technology. So I would say something like AI maybe was a peak of expectations a few years ago. We were talking about it a lot on the podcast. We're talking about it a lot less now, potentially, because it's moved through to the trough of disillusionment. Maybe AI is not quite in the trough, but this is where actually, as things develop, the product, the technology often doesn't live up as quickly as people would like to the initial, often inflated expectations for that technology. And people become a little bit disinterested, move away. There are fewer stories that we see about these technologies, and they are in the trough of disillusionment. And some products stay there forever, but many will then slowly crawl out of this along the slope of enlightenment when actually there is some adoption. They do begin to deliver on some of their expectations and deliver something useful. And then when things have been adopted and are becoming more mainstream, we would place them on the plateau of productivity. So that's understanding the graph. With me so far, Gandhi?
Absolutely. Sounds
good.
sensible.
And then the final thing just to cover is, well, okay, why might an individual who's interested in technology be interested in using this this tool to conceptualize the adoption of medical technologies, and why might an organization be interested in using this? Well, I think the main application is like the timing of adoption. So, and this depends on what organization you're in, because the type of organization you're in will dictate which types of technologies you become interested in. You start to invest your time learning about and maybe money developing and integrating in. It will. So you got to get the right match for your organization and where you are on the curve. So, for example, if you are a venture capitalist interested in making high risk bets on early stage technologies that might become important in the future, well, you're probably around this innovation trigger sort of area, because you can take a lot of risk with your resources, and that's what your business model is about. Lots of small risks, only a few of them deliver, but that's how you deliver as your organization to your investors. Now, at the other end of the spectrum, you might be a hospital trust, and actually you've got a responsibility to the taxpayers for the use of your money. You don't want to be making risky bets on experimental technology, and you probably be focusing your attention more around the slope of enlightenment and moving towards the plateau of productivity. So perhaps that's where you would focus your attention. And then there's people in the middle, like maybe us. We might want to find some gems of things in the trough of disillusionment and invest a little bit of time and attention to move them forwards because we think that they're useful. So that's why you might be interested in the curve. One final thing, just a point about resilience, which we talk a lot about on the podcast as well. It's just understanding that if you're close to, or you're one of the people developing one of these products, don't be afraid that you go through, the peak of an inflated expectations when everybody is interested in your new product or company. So this is a message for those people who watch you involved in startups or develop medical technologies. It is expected that most technologies will go through this trough of disillusionment, and don't become disillusioned. Don't give up. If you believe in your technology, stick with it, be resilient, and you should start to come through the slope of enlightenment. So that was a whistle-stop recap of hype cycles and why our viewers and listeners might be interested.
So absolutely, that's the theory around hype cycles. We actually put theory into practice this time last year, and we created, obviously, our hype cycle for primary care, general practice, or whichever way you want to look at it. And this was it, wasn't it, Andy? And it was an interesting exercise.
It was, and I think we were beginning to acknowledge, I wonder what effect COVID might have on this hype cycle. Won't it be interesting when we review it in a year's time? So here we are. Any reflections, Gandhi, on the position of some of these things? We'll move on to revising it for 2021 in a second. But anything that strikes you, maybe just one or two things?
So I think AI is probably the one that strikes me a little bit. I'm keen to know where we both think that one's shifted, because whether it has or it hasn't. And in contrast to that is video consultations, which is right at the top of that slope up there, the peak kind of thing. Because those are the two I think that have been interesting, shall we say, both in different ways.
Definitely, yeah. We almost need a sort of top 5 movers and shakers, or moving up the leaderboard sort of thing. Yeah, I mean, the ones that I think are interesting. So I think I made a prediction that primary care networks were my wild card. Not necessarily technology, but we're at that stage in innovation and something new, and that they might be at their peak of inflated expectations and about to enter the trough of disillusionment. I don't know if that's really happened, to be honest. I think primary care networks have stepped up
I
to a
think they've
certain degree.
ridden the roller coaster, to be honest, over the past year.
So yes, that's interesting. I think the best way to look at this, Gandhi, is to live on air, well, recorded as live. This will be recorded when people listen to it or watch it. That we maybe just go through, rearrange the things from last year, reflect on where they were, where we think they are going forwards. And we've got a lot of new entrants to add as well. So I think if we look at the things from last year, move around what we think should be moved around, and we'll do it live on air together, and then look at where we would position these new entrants. And some of them aren't actually all that new in terms of technologies, but have had an impact over the last year. So let's start here where things that we thought were in this innovation trigger area. So we've got genomics and genomic medicine. Has that moved forwards much?
I think the tech behind it has moved on a little bit more. So we've obviously got more advanced tech, and particularly things like the mRNA vaccines and stuff are based on the basis of the triggers that look at some of this thing, and that has potential real opportunity. But in terms of use in general practice, I don't think it's really shifted a huge amount. It's still on that slope of going upwards, on the slope of enlightenment and things. But innovation trigger. But it may have climbed up a little bit more. But I don't think it's anywhere near the peak, to be honest, still.
Yeah, the thing that's interested me is I think we were thinking about a focus on human genomics. I think that's in the future where the focus really will be. But we've talked a lot about viral genomics, haven't we, over the last year, and tracking these different strains that have emerged in different areas, and as you say, targeting, so using the viral genome in the production of vaccines, which, whilst not a primary care technology, actually we've been delivering a lot of those vaccines in primary care. So actually we've been doing a lot with viral genomics. So Siri, Alexa, Google, I don't think they've done very much in the last year.
Yeah, I think general life, they've probably become more of a factor. But in terms of general practice, again, I don't think it's really made a huge impact. It's probably just stayed the same, to be honest, in my view.
We'll leave them where they are. Virtual reality?
So I'm interested to know what you think on this one, Andy, because I think I might have a different view for you on this one.
Well, let's see. I'm going to say, I think quietly, virtual reality outside of medicine has been on a journey sort of almost past peak expectations. And I would place it sort of entering the trough of disillusionment. I think it's going to be useful, and I think it's going to be interesting, and maybe we'll all be having virtual reality meetings rather than video meetings in the future. But that's where I put it. But how about you?
So I'd still put it towards the peak, to be honest, and on the innovation trigger side of the peak, and for two reasons. Number one, in terms of virtual reality for clinical use, I think we're going to see a massive explosion of this for things like, physiotherapy and pulmonary rehab facilitated VR technology. And also just on a slight, AR, more augmented reality, all the filters and everything we use on Zoom meetings and team meetings, all that is massively exploded. And although it is not necessarily a health orientated thing, the use of VR and AR has significantly improved in society. So I'd still keep it on this side, on the shooting up side of the innovation trigger part of that slope.
Kenny, I'm going to challenge you a little bit, because I think it's interesting to do that. I think you might be making an argument for it being on the upswing towards the slope of enlightenment. That actually, maybe we're about to actually see some real life useful applications. So, but I'll let you choose. So here.
Well, I think in general life, it's probably moving towards, like you say, the slope of enlightenment. I think in medical use, there's still very much, it's in the innovation, it's in the testing phase. I know of a couple of places that are piloting it. And I think the adoption is helped by people's understanding of the technology in general view. I'll
Right.
let you place. You've got the power of the pointer, so you go for it.
I do. We're going to go coming up towards peak of inflated expectations. We'll go with your original thesis. So we've got video consultations. So, I mean, this has had a lot of movement, I think, over the last year.
Absolutely.
I think it's actually kind of leapfrogged the trough of disillusionment and just gone to plateau productivity, I think.
Yeah. I'd agree. I think although I think there's also a view that video consultations has definitely not fulfilled the hype that was probably there a couple of years ago. So we saw massive expansion, obviously at the peak of the first wave of the pandemic, into people using video consultation, and then very rapidly we saw it drop off because people realized that the use of video consultations was changing. And I think it's going to change into something else, which is one of the new entrants we're going to be talking about. But yeah, you're right about it definitely leapfrogging elements.
Shall we say leapfrogged the slope of the trough of disillusionment, and we're in the slope of enlightenment? Because I think I agree. We're not quite sure where it's going to be placed relative to audio, online, and face to face. So let's put it in slope of enlightenment. Excellent. Okay. Wearables, the next one. So they were at sort of peak of inflated expectation. What do you think?
So it depends on what we count as a wearable. I think there's a difference, and again, we've got one of the new entrants that's going to come into play that is in part with this. But if you're talking about consumer-based wearables, I think we're still, peak expectation in terms of primary care use. Will that shift? More than likely in the coming years. But yeah, I don't think it's moved a great deal when we're talking about consumer-based wearables.
I'd agree. The next one, so this was my wild card last year, wasn't it? Primary care networks. So, and you were saying, wow, maybe they've just sort of ridden the roller coaster. I'm going to say I think the roller coaster involved a bit of trough of disillusionment, and I think they're on the slope of enlightenment now. I think this is what I would say. I think they're becoming accepted by practices and becoming more useful. We're deploying the ARS roles. We've been developing them quietly during the pandemic. Some primary care networks have stepped up in a big way around vaccination, but they're not so much in other areas. That's where I place them. I don't know. How about you, Gandhi?
I'd put them right at the bottom of the curve. So I think they're still in the trough of disillusionment, but I think it depends on how you've used them and where you're using them. I think it's so variable because we're not if you're talking about as a concept, I think different places have found there to be different effects. And some places they're working really well. Some places they're still just struggling. So it's a bit of a mixed bag, but I think it's right at the bottom. It's going to go one way or the other depending on where you are.
Okay, let's position it there.
Yeah.
So interoperability, different systems working well together. I think it's probably been a good year for interoperability. We've had lots of new products which have shown quite good interoperability functions. I think there's been a lot of needs, particularly around vaccinations, actually, for different systems to talk to one another. And it's worked to a varying degree, but I'm still impressed that somebody can go to a vaccination clinic in Derby and have a vaccination, and I know about that in the GP records in a timely fashion in Nottingham. And maybe that shouldn't shock me that actually works, and it doesn't always work, but it does. I think that's really good. And also we've deployed some interoperability at a PCN level with shared kind of hub-based clinics. People, ARS staff like first contact physios sat in one practice, but able to see and interact with patients from other practices face-to-face or in video and record into their record and view their complete medical record. And so that's good. So I think we're seeing a lot of deployment. So I'd put it sort of on slope of enlightenment kind of area personally. How about you?
Yeah, same area, but I probably put it a bit closer towards the trough of disillusionment. So definitely, you're right. I think it's on the slope of enlightenment. We are seeing much better interoperability and how it can be of use. But I think we've still got a way to go before we get anywhere near the plateau of productivity for it, because there's still so many limitations in terms of how it works.
Yeah, I'd agree with that. At least people seem to care more about it now,
Absolutely.
and are more aware of the importance of it as a result of the pandemic. So I think that's really good. AI, artificial intelligence. So I think we'd felt that we were post-peak hype of enlightenment. Babylon were telling us that everyone would have a GP in their pocket. There wouldn't be a need for GPs anymore in their articles with the Financial Times and things like that. And that had sort of stopped happening by this time last year. I think it's still in the trough, actually. I think it's got huge potential to deliver, and perhaps is in the background in some of the modeling around COVID-19 and some of the deep data work that I'm sure's gone on in understanding what's happening and predicting the responses that we should be making. So maybe just maybe beginning to creep out of the trough. And I think the complicating thing here is, as we discussed when we looked more deep in AI, actually it's such a broad label. There are things that consumers might consider really fancy AI, like having a real-time audio conversation with an AI agent that they can ask questions to and receive answers to. But also AI is some of that deep learning, data stuff that happens to inform big decisions about the vaccination program and who's at risk of COVID-19 more than others as well. It's just such a diverse thing. That's where I would place it.
Yeah, I'd agree with you, Andy. Yeah, probably the best place for it. It's got so many opportunities to change and be different, but I think it's moved a little bit along the curve, but not a huge amount.
Yeah. The next one was blockchain. So I think this is like we're just well and truly still in the trough. I remember this is here because a few years ago people used to say we can maybe talk about blockchain another time, but distributed ledger essentially. And a few years ago, people were talking about, maybe there'll be medical record systems that use blockchain. And I think that's where those discussions ended. And it may never be an appropriate application of blockchain. It might be. I think it's gone away for the moment, at least in medical records. I mean, everyone's talking about Bitcoin and Bitcoin reaching new highs. So I think blockchain in the general media is alive and kicking. But for medical applications, I'm not hearing much about it in the trough.
True, unfortunately.
Yeah. Okay, moving on. Electronic consultations.
So this one I think is a bit weird because it's jumped around so much, and I think it comes down to various different. But again, I think it comes down to who you ask. But generally, I think it is moving towards the slope of enlightenment a little bit more towards it. But I can definitely understand there's going to be some of our EGP learners out there screaming at their screens right now saying, how dare you? It's just, it's awful. It's nowhere, trough of disillusionment, absolutely where it needs to be. But we'll come to that with some of the new entrants, I think, as well.
Yeah. Video consultations. I know we've moved those. That's
we'll move that one. It was mobile working.
Mobile working. So you perhaps need to, this means a bit more to everyone, I think, now.
Absolutely.
Because mobile working, I was thinking, did we mean taking an iPad to a care home, or did we mean I sit in my office at home and do video consultations with patients at my surgery, registered at my surgery? What did we mean by mobile working? We almost need to break it into bits, really.
Yeah, I think we were talking more about the whole working from home concept and remote working in that in that way. Could you do clinics from home? And we saw that partly becoming the routine with companies like you say, like Babylon and Push Doctor and Better Care Anywhere and that kind of stuff coming into the market, which is why I think it was on the slope of enlightenment. I don't know where you're thinking, but with that kind of stuff, to be honest, I'd put that in the plateau productivity. We do it so well now after a year of just chaos and change that actually I think for the majority it's become routine.
Yeah, I mean, for long periods of time, some of, particularly one of the GPs who had some kind of, had some personal circumstances around their risk was routinely just working from home, routinely for a few months, and was able to do that quite effectively. And other people would see face to face, which were fairly minimal. So yeah, I think it's become routine. So we'll put that over on the plateau. Voice transcription. It's probably not moved, has it, Gandhi? It's not been a focus for the last year. I think it was already fairly well adopted.
Yeah, but I
Where it
think
is?
the technology's become a lot more effective. So I was surprised about this when I did a review with one of the companies that produces, voice transcription for general practice, at how much better it was now compared to what I thought it used to be like. Definitely plateau productivity. I think it's shifted along, and I think there's potentially real opportunity for places to consider how to use it a lot more effectively, personally.
Yeah, I'd agree, actually.
Mhm.
Having looked at some of the products, I'd like to see maybe the cost model change
Yeah.
a little bit, to be honest. I think it could be more affordable. I think pricing it against the cost of sort of physical secretary staff is maybe a little bit old-fashioned, given what I presume to be the cost base of some of these companies and that it's a digital product. But maybe that's a discussion for another day. And electronic prescription services, I think we'd said that was pretty well adopted.
Yeah.
I think the pandemic has only made it more so. Don't come to the surgery for a green slip anymore. If you were doing that a year ago, definitely don't do that. Just go straight to the pharmacy and reduce your contact with people. So yeah, I think that's where it was. Now the more exciting thing is new entrants for this year. We'll just pick them up left to right. I think some are interesting. So we talked about wearables, but then I think something else came through around remote monitoring. So I think we were, with this new entrant, we're thinking more about actually specific, reliable medical measurements about people's parameters, and home oxygen saturation monitoring has been a big development. Used to varying degrees, I think, in different parts of the country, but that's something that's kind of just arrived. Where would you place that, Gandhi?
It's an interesting one. I think we are. I'd actually put in the slope of enlightenment, to be honest. I think the pandemic rocketed it up at the agenda in terms of how it works. And I think different ways we're going to see changes. So, I mean, like you say, oxygen saturations is an easy one to talk about because of COVID and all that kind of stuff. But I think, remote monitoring of, equipment and that kind of stuff, I think we're going to see an increased use of it, possibly with wearables. But even something like, for example, peak flow monitoring, patient monitoring from home as well, using some of these other tools like video and that kind of stuff. I think we're going to see some real opportunity here. And I think it's the slope of enlightenment, because actually people are happy with the tech itself to do it. It's just understanding the use cases in general practice is more of the issue.
Yeah, I'd agree. I think SATs are just the beginning, and there'll be so much more that we can, and so many more effective ways of getting that data into people's medical records and into the hands of decision makers. So I think that's right. The next one, so this is a real wild card. So who would have thought that one of the most innovative things in 2020 would have been text messages? Wow. We can probably... Is there more to the debate here for me? Is there more that text messages could do for us? Are we just on the slope of enlightenment with this new radical technology, or is it now plateau of productivity? So give us a bit of background about this, because when I think of text messages, I think AccuRx just
absolutely
revolutionized my use of text messages. Gandhi, give me a little bit more meat on the bones of that story, if you're able to.
So I think the key thing with text messages was obviously it was the mechanism for us to deliver most of our remote monitoring, and it's the vehicle basically of that communication. And the main reason being, majority of people have a mobile phone. We're going to talk next, I think, about one of its evolutions. But in terms of people having access to the technology, an SMS was an easy way to engage with people, particularly through remote routes. So that's why it became so used. I think it's going to get to a point where it may make itself redundant, though, because the problem with SMS is, although it's a really easy tech to use, it does have increasingly security concerns around it. And because of that, I think it's just jumped through various parts of this cycle. And definitely, I think right now we're in the plateau productivity with it, because we use it so much within the way that we communicate with things. But if there was a circle of hypeness, this is the one I think that keeps going round and round and round throughout the whole of it, isn't it?
Yeah, I think the beauty of text messages is everyone can receive a text message. Practically everyone has a smartphone, and what you end up doing really is sending them a hyperlink that then links straight through to their browser and gets them on their phone, and really gets them into whatever actual true digital interaction, be that a video consultation or an electronic consultation. It gets them actually doing what you really want them to do, which is a bit smart. There are security concerns. I think we'll probably get a better way of of getting people's attention as time goes by. But it's just
Yeah.
interesting that blitz onto the screen, or seen even. The next one, telephone consultations. So I think this is another, if you thought text messages were an old technology, well, the telephone is even older. And it's probably the biggest change in how all of us are practicing day to day, is that we are doing a lot more telephone consultations. I'm probably going to lump this to the back here, plateau of productivity, and we'll probably find ways of actually reducing the number of telephone consultations we do going forwards, going back for some things face to face, or replacing them with better electronic methods. But we've done a lot of it in the last year. So old technology come back to serve as well. Email. I'm going to do the same with email. So some of the processes that we put in place quickly around the pandemic involved patients emailing us information that we'd asked for, like images and so forth, before we found a better way of doing it. So quickly throw email in there as well. So I'm going to actually talk about 3D printing, Gandhi, because that's interesting. That we don't.
Shall we just finish our smart messaging? Because I think that's related to some of these. So I mentioned how SMS is kind of evolving into something different. I think this is what it's going to evolve into, is this whole concept of smart messaging. And it's kind of already there. Like you said, it's the hyperlink that you get in the text message that then gives you the portal to then log into to get more secure messaging, because then you have that additional security check. But then I think what we'll also start to see is things like the NHS app and more integration with systems for patients to get more messaging to and fro, and potentially, that two-way messaging system. And that's where smart messaging will come into it. For that, I think we're at the slope of enlightenment, to be honest. Kind of with it mirrors with e-consultations quite a lot, because it is kind of the similar principle, but it's also recognizing this is the evolution of what SMS has done over the past year.
Yeah, so we'll almost have these dropping off the end of the plateau of productivity, reaching the end of their useful life, and hopefully replaced by e-consultations and smart messaging, which are really doing a similar job. So that's a very tidy explanation. Let's dive in with 3D printing, because I thought this one was interesting, because we don't make things in primary care, do we? That's the role of the
pandemic
people.
you're talking about, though.
So there was a point in the pandemic, maybe about 10, 11, 9 months ago, where PPE was a really, really big issue. And one of the things people were asking me for, one of the things that I wanted to own and nearly constructed out of like a lemonade bottle or something, was visors. And there just weren't any around. And it was a real obstacle to the setting up of sort of COVID hot sites and things like that, where people thought they might be exposed to have increased exposures to COVID-19 from a patient population that were selected because they might have it and might get large initial doses, which have been associated with more severe disease in health professionals. So people wanted visors to assure them of the safety of working in those environments, and there weren't many around. So how does this link to 3D printing, Andy?
So basically, loads of areas figured out that 3D printing was a nice homegrown way of making these kind of things. So effectively, loads of places just created the visor headband and then just used a Perspex sheet as the shield. And although they're not medical grade by any means, they were functional and they were reproducible, and the community got behind us. I mean, particularly in Nottingham, led in trying to create these for our local communities in terms of the practice and stuff, to give them that additional reassurance, which actually then became part of the PPE policy, that practices were meant to have these for particular face-to-face contacts and stuff. And what I loved about this was the innovation itself. How something that was originally designed to just be something that you can kind of do at home or on an industrial scale became a way of providing protection and safety for clinicians and the public to try and manage what was clearly a really challenging period. And literally it went through that entire cycle within the space of about a month, I think. So
that's true. Actually, it could be everywhere. Actually, yeah, absolutely. Yeah, you're right. It went through the whole cycle in a few months, and then was adopted. I'm going to put it on plateau productivity, because I think if we can 3D print something that is useful for us in the future, then we will. But we could. There are a number of places we could put it, but I think think it
True.
tidily sits there, and that completes the story of 3D printed visors during the pandemic. Group consultations. So I think it's sort of facilitated by things like video meetings, which is another one of the new things, which somehow we didn't see coming. Like, who didn't put on the curve? Goodness me, why not? But group consultations for the moment.
Yeah.
Where do you think?
I think they're probably. It's an interesting. I think it's still an innovation trigger, to be honest. I think, yeah, because I don't think we've seen the mass adoption of them and the real use case benefits. Loads of stuff about group consultations focuses when we talk about medicine in particular. We talk about things like diabetes care or pulmonary rehab, and those, I think it's in the plateau of productivity. It works really well, but actually for me, where I see the real innovation is actually using it wider. And I've talked a lot about this, not only both from a face-to-face concept, but actually video group consultations. And I think it's something we're going to see continue to build. Will it hit the hype, the peak of, kind of expectations and stuff? I don't think it will. I think it's going to probably slope off really quickly, shoot through that, trough of disillusionment and go to the slope of enlightenment and productivity very quickly, almost like a straight line. But it's that initial adoption and how we use it. I think that's the part we've yet to see.
Okay, so you think
making a case for the slope of enlightenment? Actually,
let's put it on the slope of enlightenment. I think the idea has been tested with some initial use case scenarios, and we had a little bit of a peak of inflated expectations. There was a little time before the pandemic where everyone was talking about group consultations, and there was funding for innovation in that area. I think we've had a sort of pandemic imposed trough of disillusionment, and now we're coming into the slope. And actually, I think what group consultations look like now and in the future probably quite different because of the pandemic. I think it's going to be a lot more video based because people can attend more easily. They don't have to come to a physical space. You don't need a state to put it in. So I think the pandemic's done a lot to shift it forwards and change what it will look like. But I think it's a good one. It's good. It's an innovation, isn't it? Technology and innovation hype cycle, we should call this. Let's talk about, let's leave video meetings till last, and let's talk about home working, which we alluded to a little bit with mobile working and indicated we thought that maybe this was becoming mainstream. Anything more to say about home working, Andy?
Well, yeah, I think it is very much moving towards plateau productivity because we've been rocket fueled by the pandemic, moving many of these things past, and a lot of the limitations that were there to create home working for primary care, I think are gone. We know the tech is there. We know people can do it. It's just sorting out the fine, the last little nitty gritty bits to make it reasonable and feasible for, the majority. So yeah, it's in the plateau from my view. I mean, I do it sometimes, still having to do it because either I can't go in because I'm isolating or whatever. So, it's doable.
Yeah, I'm actually going to put it as just coming onto the plateau because I think we will still see a lot more of it going forwards, actually, and more innovation around it. And I think there's a lot more innovation that can happen. If people can work from home, then, underdoctored areas or areas where you don't have as many doctors, deployed or willing to live in and around those areas, maybe some sparsely populated rural locations or rural coastal communities. I think there's a lot of innovation that can happen in terms of moving healthcare resource like GPs remotely into those areas from their own homes. I think there's just a lot more that we might see around that. So that's good. Okay. Now, supporting patient information management. We were having a debate about what to call this, and I'm still confused by what we chose to call it, actually, Gandhi. So what is this and where would you place it?
So I think particularly over the past year, many different clinicians and groups and services have been trying to help educate patients about the correct information. We've seen this through various different parts. Initially, information about the pandemic itself and COVID and how much of a risk it generally was, the whole concept of isolation and social distancing, and then obviously moving towards vaccinations and how we can encourage patients to understand why vaccinations are a positive thing. And, you can chuck in fake news into this, all that kind of stuff. But in terms of clinicians themselves coming forward and talking to their communities, I think we've seen a massive change in the way that practices and various different organizations have looked at doing this. And for that reason, it is an innovation because many people are doing it for the first time. or trying it out, and with varying different levels of success, whether that's locally, regionally, or nationally. But I think, I was quite keen to have this somewhere on the hype cycle, because I think it is something that has changed, and I think there's also lots of room to adjust with it, but also lots of really good learning out there as well to help people understand how to do it effectively. So I honestly, Andy, don't know where to put this on the cycle, if I'm being honest.
Actually, you know what? I was putting it there, and there's I think what we're finding is there's a lot of similarities between coming out of the trough of disillusionment and actually being an innovation trigger. I think it's close to innovation trigger, because I think it's this whole concept of healthcare professionals communicating with patients in a different way. So it's communicating with patients outside the consultation, be that by creating videos or posting themselves on social media, or addressing patients in a different way. And I think that that's a big area where health professionals could be more effective for health in their communities. But I think it is really, really early. So I would put it as innovation trigger sort of area. And we might even get some hype, and then people say, oh, isn't this good? Isn't this bad? And we might have some bad news stories, and then maybe we'll be on the safe for enlightenment. That's where I place it. But happy for you to quarrel with me.
No, that sounds perfectly. Yeah, like I said, I wasn't quite sure whether it was innovation trigger or slope of enlightenment. I think for different people, it's going to be a different place. I think for me, it's going to be plateau productivity, because I do this almost on a daily basis. But I can completely understand many of our peers and colleagues and EGP learners out there, and definitely this is somewhere where they think, oh my God, I can't even consider doing it. But that's not a problem. To be honest, we're here to help you do it if you want to, but that's a separate story, shall we say.
Yeah, but you're an innovator, Gandhi. You're an innovation trigger person, which is why I think it's there. And the final thing, which we'd save till last, that was not on the Primary Care Technology Hype Cycle 2020, for some reason, was video meetings. And my goodness, have I been in a lot of video meetings as a professional over the last year. So it wasn't even on there. If it was on there, Gandhi, where was it last year? Video meetings. Just if it was on there, were we talking about things like Zoom and things? It feels like we were in February. Were we talking about Zoom?
We were, and I think so. For us, I think it would have been innovation trigger, because although me and you were really happy and comfortable and confident using it, and we've been doing it for a while, I think for the majority of the NHS, it was still meh. We like our physical meetings. We like getting together. It was innovation trigger territory, because there was such a resistance from moving away from face-to-face meetings, generally speaking. And then, my God, did it change?
Yeah, we were having the Primary Care Network leads Zoom meetings, weren't we?
Yeah.
By this time last year, so we were doing it. So I mean, it's probably. I mean, it must be plateau productivity.
Absolutely.
It just must be, because it's so. I have one every day at least. Sometimes like 6 a day of video meetings.
We're doing it right now, aren't we? This is how we're recording the episode, because we're still in a state where we're not allowed to be physically in the same room together. So,
Yeah. Wow. And we've done lots of videos, haven't we, about video meetings, how to do them well, the advantages of them, and the darker side and the things that they don't do well, and how to mitigate against those things as well. So people can search for those videos if they want to make their meetings better or avoid them being bad. Then have a look back through some of the older EGP learning videos over the last year. We've had a lot of fun with video meetings. So there we go. We got through it. Do you think we got it right?
I don't know. I'd be interested to know what EGP learners think. So absolutely, in terms of your views, your comments, is there something that we've done horrifically wrong here? Is there something we've got right and actually you agree with us? Or more importantly, is there something we've missed? Because that's the part I'm keen to know. What have we actually missed that's out there that isn't on this hype cycle and absolutely needs to be? Maybe we'll see it again next year when we review it. But definitely keen to hear from people what they think in terms of our view of the primary care technology hype cycle.
Excellent. Well, that's been a thoroughly enjoyable episode. I hope people enjoyed it. I hope people will browse some of the older videos and hit the subscribe button on whatever platform you're listening or watching us on, and join us in the future for more EGP learning. Any closing words, Gandhi?
As always, we're here to tech enhance your primary care and learning. We'll catch you in the next episode.